क्वेश्चन नंबर 25 से बात करने का टंडन सिंड्रोम में क्या होता है। 45X कैरेक्टराइज बाय एब्सेंस ऑफ एक्स क्रोमोसोम। टंडन सिंड्रोम में ऐसा होता है। शॉर्ट स्टेचर होता है, वेब नेक होता है, स्ट्रिक ओवरीज होती है। दूसरा स्वेयर सिंड्रोम 46 प्लस एक्स, a form of pure gonadal degenesis where individual have male karyotype but possess female external genitalia also. Normal uterus and strict gonad due to mutation in sex determinant gene like SRY. Androgen insensitivity syndrome, इसमें भी वही होता है 46XY. Genetically male individual who have a complete lack of regional response to androgen resulting female external phenotype, but the absent uterus, fallopian tube, and presence have undescended testes. MRK, genetically normal females who presents with the congenital absence of uterus, upper two-thirds of vagina, but have normal ovary secondary sex. महिलाओं में एक्स क्रोमोसोम कम होता है जिसमें कम लंबाई अविकसित अंड है। स्वायर सिंड्रोम, एंड्रोजन insensitive syndrome. A person was brought to the emergency department with facial swelling, itching, hypotension following a bee sting. एक व्यक्ति को मधुमक्खी के डंक मारने के बाद चेहरे पर सूजन, खुजली, ऑर्गन में रक्तचाप के साथ आपातकालीन भावना है। IgE. It's a clinical presentation described anaphylaxis, which is a classic life-threatening type 1 immediate hypersensitivity reaction triggered by a bee sting. Upon exposure to the allergen-specific IgE antibodies bind to high-specific receptor on mast cell and basophils. This cross-linking triggered degranulation, releasing massive amount of histamine and other mediators. Histamine causes vasodilation, leading to hypotension, increased vascularity, permeability, nerve stimulation, itching. IgA primarily responsible for mucosal immunity found in tears, saliva, cholesterol. IgM, first antibody secreted during primary immune response and infection. IgG, the most important circulating antibody. Best method of identification of decomposed body is DNA analysis. When a body undergoes advanced decomposition, protein section ratios, soft tissue, skin layer, and facial features. DNA analysis is the most gold standard and best method because DNA can be easily extracted from highly stable tissue like deep skeletal bone or intact teeth, even after soft tissue have completely liquefied. Fingerprinting is the most reliable method for a fresh body or early decomposition, but it becomes impossible once the epidermal skin slips off completely. Osteology, studying bones, help determine sex, stature, but cannot pinpoint absolute personal identity like DNA. With the reference of drug fooding, consider the following statement. Healthy human drug proving is the only pure and reliable method to understand and pathogenetic action of medicine. Pathogenetic action of medicine. Toxicological symptoms observed from accidental poisoning by earlier authors were noted by Hahnemann to closely match symptoms produced during controlled feeding. स्वस्थ मनुष्य पर किया जाने वाला औषधि परीक्षण दवाओं के असली गुणों को जानने का एकमात्र विश्वसनीय तरीका है। पुराने लेखकों द्वारा टॉक्सिकोलॉजिकल सिम्टम्स हैनीमैन के परीक्षणों से बहुत मेल खाते थे। मॉडरेट small dose. अल्ब्रेक्ट वॉन हेलर ने केवल मानव परीक्षण का सुझाव दिया था। Legume aggravation, aggravation and emulation general. Phlegmatic, phlegmatic mind temperament describe mental psychological state. Sunstroke after effect. Sunstroke after effect. Head internal. Sunstroke impact the central nervous system and reduce severe headache. Boger specifically catalog this under the internal headset. Infants' affection, sensation and complaint in general. General dynamic condition affecting a specific age group like infancy, childhood are listed under the broad sensation and complaint. बीबीसीआर की जिस बीबीसीआर का सही मिलान लेग्यूम एग्रीवेशन ये एग्रीवेशन फ्लैगमेटिक ये माइंड सनस्ट्रोक हेड एंड infant sensation and complaint. Pediatric which of the following congenital heart disease has equal saturation in all heart chamber? Total anomalous pulmonary venous circulation. All four pulmonary veins fail to connect to the left atrium. Instead, they abnormally drain into the right atrium. As a result, the entire oxygenated blood returning from the lung mixes completely with the deoxygenated system. Venous blood right side inside the right atrium. Because of this complete mixing before distribution through ASD or PFO to the rest of heart, oxygen saturation become equalized across all four chambers. Teratology, tetralogy of folate characterized by right to left shunt via VSD. Saturation are highly unequal between the right and left side. Tricuspid atresia. Tricuspid atresia. The tricuspid wall is missing, limiting right ventricle filling. Blood routing is highly asymmetric. Transposition of great artery. Two parallel independent circulation saturation. एक 19 वाली महिला की नियमित जांच में लगातार थायरोटॉक्सिकोसिस उच्च थायराइड पाया गया। उसे हल्की टैकीकार्डिया लेकिन वजन घटने का अपने आंखों की समस्या नहीं। उसकी माँ और मामा को भी, लेकिन उन्हें कभी इलाज की आवश्यकता नहीं पड़ी। जांच से पता चला कि in a case present a classic textbook scenario resistance to thyroid hormones, usually caused by autosomal dominant mutation in thyroid hormone receptor. Because the receptor in the pituitary and peripheral tissue are defective, the normal negative feedback mechanism is impaired. The pituitary requires higher level of thyroid hormone to suppress TSH, resulting in high free T4 and free T3 paired with a normal inappropriately elevated TSH. Most patients are clinically euthyroid or only mildly affected because of high level of circulating hormones compensate for the receptor resistance. The family history strongly point towards the inherited autosomal dominant. Activating mutation of TSH receptor. This causes familial gestational hypothyroidism or toxic adenomas, where high T3 by T4 would completely separate TSH to undetectable level. International unit. All of the following ions have decreased concentrated on luminal side of the proximal convoluted tubule. निम्नलिखित में किस आयन को छोड़कर अन्य सभी की कंसंट्रेशन क्लोराइड है. In the PCT of nephron, solute reabsorption occurs progressively. Glucose, amino acid, bicarbonate actively absorb sodium. This rapid transport significantly drops their concentration on luminal side compared to the beginning of it. In contrast, chloride ion is not actively transported in large amount in the early PCT. As water leaves the lumen to follow sodium, glucose, bicarbonate, the chloride ion are left behind. Consequently, the concentration of chloride actually increase or stays relatively high. Stays relatively high in the late PCT. Presence of small scarred kidney with papillary calcification. Small scarred kidneys with papillary calcification. Calcification. बिना कंट्रास्ट वाले सिटी स्कैन में छोटे स्कार और पेपिलरी कैल्सिफिकेशन का दिखना निम्नलिखित एनाल्जेसिक नेफ्रोपैथी. is a form of chronic intestinal nephritis caused by prolonged excessive consumption of analgesic mixture like NSAID. The classic radiological hallmark of non-contrast CT scan can include bilateral decrease in kidney size combined with renal papillary necrosis and calcification. When these calcified papillae line the renal pyramid, they form the distinct circular garland. Reflux nephropathy क्या होती है? Characterized by coarse irregular scar typically located at the upper and lower poles of kidney associated with blunted calyces. Allergic interstitial nephritis and acute drug reaction. Rubric related to various occupations are mentioned in detail. Repertory of hearing guidance center. NAIR repertory. Complaint of bookkeepers, seamstresses, miners. Dr. Kelvin V. Nair ने hearing guide संस्था. Kelvin V. Nair. Kent repertory or occupation are mentioned scattered under generalities. Ailment form. Bony Nation follow concept of grand generalization. BBCR contain clinical rubric but does not possess the unique occupational compilation found in NAIR report. So the following statement regarding diabetes mellitus are correct. Glucose intolerance developing in first time. So, children born to mother with gestational diabetes increase risk of metabolic syndrome. Mood is characterized by autosomal dominant inheritance. Type 1 diabetes developed due to autoimmunity against insulin. सब सही है. पहले को छोड़ो. If the following statement regarding homeopathic therapeutic is correct. In homeopathic treatment of disease, drug is never given for its pathogenic action. The pathogenic action is never curative. The physiological action of drug is not therapeutic, not curative. According to Dr. Stuart Clark and Dr. H. Robert in their treatise on homeopathic philosophy, a drug pathogenic action refers to its power to produce disease-like symptoms in a healthy person. Toxic primary effect. In clinical practice, we never administer a remedy to intentionally induce these cross-pathogenetic or destructive change in body. Rather, we utilize the drug similarity to stimulate the curative secondary reaction of vital force. Hence, raw pathogenic action itself is never directly curative. Large dosage producing material changes side effect as seen in opposite to its therapeutic action in homeopathy. Pathology. Which of the following is seen in osteoporosis? Osteoporosis can have a decrease in total bone mass, leading to fragile bone, but the quality of the remaining bone is entirely normal because it is metabolic disorder of bone remodeling rather than mineral deficiency. High turnover destructive disease. The serum biochemical profile remain unaltered. There were patients with osteoporosis who normal osteoporosis सामान्य सीरम फॉस्फेट कैल्शियम भी एल्कलाइन फॉस्फेट ऑस्टियोमलेशिया जिससे लो हो जाता है कैल्शियम फॉस्फेट्स लो एल्कलाइन फॉस्फेट पीजेड डिजीज नॉर्मल एक्सट्रीमली एल्कलाइन बहुत हाई होता है द फॉलोइंग इज नॉट कॉज ऑफ सेकेंडरी एमनेरिया टर्नर मोजैक The failure of menses is initiated at the 15 instance of normal secondary or by the 13 in absence Turner syndrome. Secondary amenorrhea, the absence of menses for 3 months in women with previously had regular cycle, 6 months in women with irregular cycle. Kalman syndrome, Asserman syndrome. एमेनोरिया को दो प्रमुख श्रेणियों में विभाजित किया जाता है प्राइमरी और सेकेंडरी प्राइमरी जब किसी लड़की को उम्र भर में कभी पहला मासिक धर्म शुरू ही न हुआ Kallman's congenital condition characterized by deficiency of GnRH associated with anosmia, loss of smell. It presents secondary amenorrhea, it functional gonadotrophic failure of postpartum pituitary Sheehan syndrome. Asserman acquired condition where intrauterine scarring from usually from over aggressive uterine curettage, completely blocking menstruation. According to Hahnemann instruction on preparation and storage of which of the following is the organ of Ephesians 266 to 268. Samuel Hahnemann gave highly specific instructions on how to handle medicinal plants. He emphasized the fresh indigenous plants should be extracted immediately and their raw juice must be mixed with equal part of alcohol. to halt fermentation and preserve their dynamic therapeutic energy perfectly. This food must be kept in tightly sealed vial and shielded carefully from direct sunlight and environmental. ऑर्गन ऑफ मेडिसिन के फ्यूजन 266 और 268 में डॉक्टर हेरमन ने ताजे पौधों से मदर टिंचर को तैयार करने के स्पष्ट विधि को बताया. Homeopathic substances must never be fermented or mixed with table salt. पॉजिटिव इंक्रिस्टेंट साइन क्या है? डी क्वेरवेंटिनोसाइनोवाइटिस. Specific diagnostic were used to dequervin synovitis, inflammation of tendon within the first dorsal compartment of the wrist. The best test is performed by having the patient flex their thumb into the palm, close their finger over thumb to make fuss, and then gently deviate the wrist towards the ulnar side. A positive sign. Bicipital tendinitis, inflammation of long head of biceps. Patellar tendinitis, commonly known as jumper knee, affecting the knee joint, presenting with localized tenderness and other patellar tendon, commonly known as fusion adhesive capsulitis. Adhesive capsulitis. Global painful restriction of passive and active range. Passive and active range. Homeopathic materia medica. Despondent, hopeless, thinks her disease incurable, has not friend having could keep away moment. रोगी अत्यंत निराश, हताश और सोचती है कि उसकी बीमारी कभी ठीक नहीं होगी, उसका कोई दोस्त जीवित नहीं बचा, जीवन जीने का कोई मूल्य नहीं है. लैक कैन आई नो. The mental state of lack is saturated with profound despondency and acute lack of self-confidence. Lack of self-confidence. The deeply rooted delusion the patient is firmly convinced that they are completely friendless, that their chronic ailments are entirely incurable. Graphite is widely said but characterized by physical obesity, skin crack, cinchona despondent and full of plans, but typically suffering from physical weakness. According to Hahnemann, which of the following statement is most correct? A repetition of dosage is inversely proportional to the irritability. ऑर्गन को 247 से 248 एफोरिज्म के रिपीटेशन डोज में बताया गया है कि खुराक को दोहराने की आवृत्ति चिड़चिड़ेपन. अगर किसी को बार बार दवा बढ़ा रहे हो तो उसकी चिड़चिड़ेपन इरिटेबिलिटी ज़्यादा होगी. अर्थात यह कि रोगी की संवेदन दवा को उतना कम बार बार. अगर पेशेंट ज़्यादा इरिटेबल है तो दवा कम बार. Need not to be frequent repetition. Which one of the following classes used to triturate lysine? Class 8. Nine classes, strictly dedicated professional allied no sword and sarcode, which include animal secretion, pathological proof. Lycidum produce saliva of rabbit dog. Class 6B, fresh vegetable and animal liquid alcohol mixture. Alcohol mixture. इन्वेस्टमेंट तुम्हें ही करना पड़ेगा. Potent medicinal substance. Employment for the management of shoulder dystocia. Wood's manure. Shoulder dystonia occurs when the fetal head is delivered but the anterior shoulder become impacted behind the maternal symphysis. It is an obstetric emergency managed using specific sequential. M. Robert Manuel. The initial step involving hyperflexion of maternal thigh against the abdomen, which flatten the sacrum and rotate the symphysis pubis superiorly. Woodcock screw manure. Woodcock screw manure. एक गंभीर ऑब्स्टेट्रिक इमरजेंसी जिसमें बच्चे का सिर बाहर आने के बाद उसकी माँ कंधा माँ की जबन के पीछे अटक जाता है. लेफ्ट मैनुअर यूज्ड exclusively left maneuver. Left maneuver used during breech presentation. Pinard maneuver. Frank breech. Medicinal diseases are more powerful than miasmatic disease and therefore are capable of permanently extinguishing them. सही है. Medicine unconditionally on all individual under all circumstances. डॉक्टर सैमुअल हनीमन ने 30 एफोरिज्म में बताया कि ह्यूमन बॉडी इज मच मोर ससेप्टेबल टू बीइंग अफेक्टेड बाय मेडिसिनल फोर्स देन बाय नेचुरल डिजीज. The medicinal disease are artificially engineered to be inherently more powerful than natural disease. By applying a homeopathic remedy, this stronger artificial disease permanently extinguishes the weaker natural disease based on homeopathic law of nature. Why are medicine more powerful? As explained in aphorism number 31 to 33, natural disease acts on only conditionally. However, medicine act unconditionally. As per aphorism number 237, its stage of apyrexia is very short. Prescribing begin to avoid other substances, subsequent phenomena expiring. सामान्य तौर पे जो एफिलिएशन नंबर 237 में लिखा है कि पैरेक्सिया के दौरान दवा दी जाती है, लेकिन कुछ अत्यंत खतरनाक बुखारों में जब बिना बुखार वाला समय बहुत छोटा होता है, पूर्ण उससे बुखार इंतजार, ऐसे मामले में दवा तब दें जब रोगी का पसीना कम, perspiration to begin abate. Chest affection with stitching pain synchronous with pulse बढ़ता है from motion, palpitation, violent, visible and audible from wrist motion. When bending forward, systolic blowing at apex. This highly descriptive clinical snapshot outlines the core cardiovascular and respiratory keynote of dysphagia. Stitching pain synchronous with pulse. This is classic hallmark symptom of dysphagia and pericarditis and pleuritis. Violent palpitation, visible and audible. The contraction of the heart are so intense that they are lifted to the chest wall, and the head patient or someone standing nearby, heavily aggravated by moving or bending forward. Lateral heart palpitation are prominent but characterized by irregular intermittent pulse, heavily aggravated when lying down, especially on left side. Nausea indicated in valvular heart disease with dry teasing cough, but lack the specific spiculators of stitching by clicking exactly the point. Muriatic acid का palpitation of heart is felt in the face. Palpitation of heart is felt in the face. Beta SCG structure is similar to which biochemical moiety? LH. Beta SCG. Human chorionic gonadotropin SCG. LH and FSH. Thyroid stimulating hormones are all glycoprotein. Composed of two subunits, alpha subunit and beta subunit. Structures SCG bind to the same LH choriogonadotropin receptor, mimicking LH to maintain the corpus luteum and ensure continuous progesterone production during early homeopathic pharmacy. Homeopathic attenuation of antigens are called Ehlers-Danlos, such as pollen, specific protein. Iso derived from chemical, pharmaceutical like environment like medication, heavy metals, vaccine. No suit, charcoal. The characteristic feature of thromboangiitis obliterans, claudation of affected extremities, aortic aneurysm, migratory superficial vein thrombophlebitis, migratory superficial vein thrombophlebitis, Burger's disease, non-atherosclerotic segmentally ischemia lead to severe intermittent pain in calves, feet upon walking. Aortic aneurysm नहीं होता. Inflammation of surrounding superficial lead to migrative superficial thrombophlebitis, nodular painful venous cords, location to location, location to location. Cystic medial necrosis, cystic medial necrosis. Practice of medicine. The old criteria. पहला ही ऐसे ही. The most common cause of Cushing syndrome, iatrogenic. Cortisol की मात्रा ज़्यादा हो. It broadly divided into exogenous and endogenous causes. Well, the most common cause of Cushing syndrome is iatrogenic administration. Long-term therapeutic use of oral steroid like prednisolone or dexamethasone. Pituitary corticotropin adenoma, most common cause of endogenous hypocortisolism. Ectopic secretion of ACTH. Adrenocortical adenoma. Adrenocortical adenoma. Modus operandi 29. How a homeopathic cure takes place dynamically via the production of stronger artificial agents. Idiosyncrasis. Exosolar 117. Define individual who possess an unusual mental disease. 210 to 230. Removal of totality. The rubric urination dysuria. Dysuria bladder में any functional act passing urine modification जैसे dysuria incontinence, dysuria incontinence, retention and tenesmus. Bladder chapter. Bladder urination dysuria. केन ट्रिपल्टी में मूत्र संबंधी विकारों को अलग अलग लेते हैं किडनी ब्लैडर प्रोस्टेट पेशाब करने की क्रिया प्रवाह में बदलाव या दर्दनाक मूत्र जैसे सभी रूप जैसे डिस्यूरिया इनकॉन्टिनेंस रिटेंशन ब्लैडर ब्लैडर यूरिनेशन डिस्यूरिया किडनी कंटेन ऑर्गेनिक रीनल पैथोलॉजीज एब्सेस पेन लोकेटेड milk production in pregnancy is inhibited by high estrogen and progesterone. During pregnancy, the anterior pituitary gland secretes very high level of prolactin, which is the primary hormone responsible for stimulating milk production. Stimulating milk production does not occur during pregnancy because the placenta produces immense quantities of estrogen. High circulating level of estrogen causes the anterior antagonize the action of prolactin at the breast tissue, blocking the actual synthesis. Once the baby is delivered and placenta separate, estrogen progesterone level plummet abruptly. Plummet abruptly, removing the inhibitory block. Removing the inhibitory block and allowing prolactin to induce full-scale milk production. Rubric cancer noli me tangri on notch. Mention in which chapter of Noli me tangere historical Latin touch me not. Describe corrosive Magdalene cancer. Practice of medicine. Which of the following statement correct about grades of murmur? Audible with otoscope. Grade 2 murmur is faint but audible with stethoscope. Cardiac murmur are graded using Levine grading system 1 to 6. Extremely faint grade 1. Grade 2 faint but clearly visible. Grade 2 faint but clearly easily audible. Grade 3 moderately loud. Moderately loud. Grade 4 loud intensity. Loud intensity. Grade 5 very loud. हृदय में आने वाली मरमर की तीव्रता को जानने के लिए लेविन ग्रेडिंग सिस्टम का उपयोग बहुत ही धीमा ध्यान से सुनने पर पुट्रिड मीट granulations condylomata polypi pale red cellular bleeding acid. As a king of antipsychotic remedies, those are eminently indicated for all kinds of morbid wart-like feces, overgrowth, condylomata, granulation, and polypi, mucous cavities. Mucous cavities. The ear discharge is uniquely offensive, carrying a characteristic stench to putrid news, and these vascular overgrowth bleed at slighted touch. Chronic catarrh of the middle ear with snapping and noises, along with thick white or mastoiditis, condylomatous, but lack condylo. All the following tests are related to pasteurization of milk except iodine test. Process of heating milk to destroy pathogenic microbes without altering its nutritional value. Phosphate test, the gold standard test to check if pasteurization was successful. Raw milk that is destroyed temperatures slightly higher than those of required to kill Mycobacterium tuberculosis if phosphorus is absent. Standard plate count, methylene blue reduction test, used to check the bacteriological quality and cleanliness of milk before and after pasteurization. Iodine test is used strictly to detect the alteration of milk. ये फॉस्फेट टेस्ट जांचने का मुख्य तरीका कि पार्टिकुलर सही से हुआ है नहीं, क्योंकि ये एंजाइम को तापमान को पूरी तरह नष्ट हो जाता है। स्टैंडर्ड प्लेट काउंट और मिथाइलिन ब्लू टेस्ट बैक्टीरिया की कुल संख्या में शुद्धता की जांच करती है। Which one of the following medicine was dropped in Allen edition of Morning Acid Therapeutic Pocket? TPB, KTF Allen, Augusta Villa, TF Allen, Timothy Field Allen, Timothy Field Allen. Born in a therapeutic pocket book in 1891. He introduces major structural alteration, one of the most famous historical facts regarding this. Colic diarrhea attack preceded by constipation. Alois Ocotino. Abrotenum characterized by alternate constipation and diarrhea when one gated breaks. It's also well known marasmus of lower activity. Aesculus constipation accompanies sensation of diarrhea. Alternate with lumbosacral backache. Lumbosacral backache. Illumina inactivity of rectum, even a soft stool required practice. Inactivity of the rectum. Even a soft stool requires great strength. Convulsion with extreme coldness of body except head occiput which may be elevated. During hydrocephalus, meningitis, brain irritation, the patient develops convulsion where the entire trunk and limbs become extremely cold, but the head or occiput remain paradoxically hard. Hypericum may be convulsion after blow or head or concussion of spine nerve without this specific systemic hot and body cool temperature. The karyotype 45X is characteristic of Turner syndrome. Turner syndrome is a genetic disorder affecting female characterized by the partial or complete absence of bone growth. महिला में होने वाला आनुवंशिक जिसमें एक्स क्रोमोसोम में से एक क्रोमोसोम पूरी तरह आंशिक रूप से गायब होता है इसका कैरियोटाइप 45X है। इसके लक्षण में कम लंबाई, गर्दन की त्वचा का फैलाना, क्लाइनफेल्टर सिंड्रोम 47XXY, Rince-Riefenstein syndrome 40XXY. Remedy for abscess in spleen in Kent-Repertory, hypogenum. In Kent-Repertory under abdomen chapter, locating complaint of specific internal organ required checking the subrubric. Hypogenum. Glandrine. Malin. Deep-seated upset including दोनों विशल ऑर्गन लाइक स्प्लिन किंड की रिपट्री के एब्डोमिनल डैम है सीनोथस enlarged spleen and deep belly. But it is not a specific indicator. Stylicia helpers. These are universal remedies for abscess anywhere in body, but for this specific organ targeted lubricant can abdomen chapter, abscess, spleen. Roots of biennial plant. Biennial plant should be collected in the spring of the second year. In homeopathic farmers, the rule of collecting biennial plant for 2 years. Roots of biennial plant should be collected in autumn, not first year of every spring of the second year before active. होम्योपैथिक फार्माकोपिया मानकों के अनुसार जो बाइन्यूअल प्लांट की जड़ें होती हैं वो ऑटम में या दूसरे वर्ष की बिल्कुल शुरुआत या वसंत में एकत्रित जब पौधा सुप्त अवस्था। इन पौधों की पत्तियां दूसरे वर्ष के वसंत में फूल आने के समय एकत्र की जाती क्योंकि उस समय पत्तियों में औषधीय तत्व अपने चरम पर होते हैं। चूंकि प्रश्न दी गई दोनों पत्तियों वैज्ञानिक नियमों के विपरीत समय होता है। एनीमिया मुक्त भारत डज नॉट include anemia मुक्त भारत program does not include mid day meal scheme. Anemia Mukti was strategy launched by the government of India accelerate the decline of anemia through successes include intervention at aspects incorporate delayed card clamping at birth temporal wire midday meal scheme known as the PM Poshan has a separate broader school meal program managed by Ministry of Physical while it helps in combat general malnutrition. Cannot bear bed cloth or night dress, touch throat abdomen, make her nervous, lachesis. Lachesis patients possess extreme hyperacute sensitiveness to touch, but with a unique modality, they cannot tolerate tight clothing. Which of the following remedies are proved by staff? Crocus sativa, platina, and misery. Crocus sativa, platina, and misery. Johann Ernest Staff was one of the Dr. Samuel most trusted and close discipline famous for publishing first achieve for the homeopathic electricity. He independently conducted extensive high quality drug program. Crocus sativus, Mesodymium, and Platina. Antimonium proved by Dr. Samuel Hahnemann. Sabadilla proved by along with Hahnemann group. Rubric photophobia is present with chapter eye and vision only. Eye and vision only. In Boger-Bonninghausen characteristic repertoire, the structural classification of eye symptom is combined to dedicated combined section. If you are photophobia, Boger-Kent structural eye complaint and functional visual situation close together, unlike some misconception where students look under the mind chapter. Sinuses are mentioned in which chapter of our knowledge? Head internal content, intracranial symptom, headache, deep brain, content, facial expression. Homeopathic material, Helonias, veratrum, veratrum, Helonias, veratrum, album, veratrum viridi किस family से है? Melanthesi. Homeopathic medical remedies by their botanical family reveal shared toxicological and pathogenic themes. Elunia diasca veratrum alba veratrum viridi belong to Melanthesi. Melanthesi. Loganiaceae neurotoxic. Loganiaceae neurotoxic. जैसे जेल्सिमियम इग्निशिया नक्स vomica स्पैजिक ranunculus burning acrid and highly inflammatory symptom aconite actia racemosa simisi fever allivorous and hydrosis. Homeopathic materia medica urine thick turbid yellow like rotten Daphne indica. According to Alan Kino, Daphne indica is a very clear and highly verified urinary curd. Urine thick, turbid yellow, exhaled fall odor precisely like rotten egg. Text expressly noted that chamomilla has a stool, not urine. Oh, very offensive, like rotten egg, like rotten. Colchicum characterized by extremely acute sense of smell, where the odor cooking food, especially food, eggs or fat, causes painful nausea. Magnum for uric acid deposit and difficult stomach. According to homeopathic philosophy, which among the following is true about the second sacrum sanctus? This question refers classical philosophy from Vedic and the placebo sacrum. By appendectomy, the chances of Crohn's disease reduces. Appendix contains lymphoid tissue and immune activity of lymphoid tissue can cause abnormal in Crohn's disease. In fact, multiple studies show that neuropathic clonal is often associated with subsequent risk of Crohn's disease. Crohn's disease is a transmural granulomatous inflammatory bowel disease driven by complex interplay of genetic susceptibility, gut microbiota, and systemic immune dysregulation involving the entire GI tract. The lymphoid tissue of appendix is not the primary physiological driver. Crohn's disease layout. अगले कोलेस्ट्रॉल और क्लासिकल सूडो के अनुसार अपेंडिक्स निकालने से क्रोन डिजीज का खतरा कम नहीं होता. Medicine prepared from the poison of Gila monster, Heloderma horridus. Heloderma horridus. Gila monster. एक विषैली छिपकली के जहर से तैयार की जाती है. Coptic coldness, paralysis. Toxicofilm prepared from the venom of mosaic snake. Which of the following medicine is not prepared from whole living animal? Coccus cacti, Formica rufa, prepared from whole living. Apis mel, prepared from whole living. Culex musca, prepared from whole living. Coccus cacti is prepared from living animal. It is prepared from dried bodies of female cochleal insect. If calculi obstruction in middle one-third of the ureter, then pain radiate to iliac fossa, hypogastrium, and groin via iliogastric nerve. And groin via iliogastric nerve. Subcostal iliohypogastric path. Nightly suffocative attack want the door and window open, become suddenly wide awake at night, drowsy in afternoon. जिससे मरीज खिड़की दरवाजे खोलने की रात ना चाहते. The complete symptom of composition present a poor constitutional depression. Sulfur patients are notoriously worsened at night when nightly suffocative force them open through wide catch. The sleep cycle disrupted, drowsy. The chronic miasm under chronic disease springs from miasm, which is most easy curable in its unchanged form but without being complicated by psora. वह क्रोनिक माइग्रेन में उससे उत्पन्न वाली बीमारी कौन सी है जिसे थोड़ा से जटिल न होने पर सबसे आसान है? साइकोसिस। In this monumental work, the chronic disease Dr. Samuel Hahnemann explicitly discussed the prognosis and treatment of three chronic migraine. In the preface to the second edition of Organ, the object of cure, one manufactured to order by pathology, his context in statement, cutting down of innumerable and enforceable variety in the range of disease. In the preface of second edition of Organ of Medicine, तो कहना था कि तत्कालीन चिकित्सक अपनी थ्योरी के अनुसार बीमारी को काल्पनिक नाम रखते थे, तो मानो वो पैथोलॉजी कागज पर बीमारी का नाम। In the preface of second edition of Organ of Medicine, a new drug has been introduced into the market which was found to decrease mortality, but it does not cure. प्रिविलेंस, बाजार में एक नई दवा पेश की गई जो मृत्यु दर को कम करती है लेकिन बीमारी को पूरी तरह ठीक नहीं करती। प्रिविलेंस इज इक्वल टू इंसिडेंस इनटू ड्यूरेशन ऑफ डिजीज। इसका अर्थ है कि प्रिविलेंस, इसका अर्थ है कि किसी निश्चित समय में पुरानी व्यापकता में कम तब कम होगी जब मरीज या तो ठीक हो जाए या तो मर जाए। रिवर्सल ऑफ ऑर्डर ऑफ क्योर सिम्टम्स आर टेकिंग। ऑर्डर ऑफ क्योर का उल्टा होना, लक्षणों का अधिक गहरा डीपर धारण करना, भले ही बाहर से वस्तु। पेशेंट फील बेटर बट इज ग्रोइंग वीकर। Hearing loss, true radical healing always from within outward, some more important or less important, and the reverse order of cure. When prescribing cause a reversal of this order, it means the disease is moving inward. Suppression targeting deeper, more vital organ, skin eruption, disappearance, asthma development. Suppression, the patient might experience a superficial or initial relief of their prominent noticeable external. Patient does not feel better but gaining strength. Patient feel cold to the very bones, coldness not relieved by anything, headache not constitutional, abnormal sensitivity to damp cold. रोगी को हड्डियों तक में अत्यधिक ठंडक महसूस होती है। एरेनिया डायडेमा, आप इस पद्धति का सही से यूज करो। This complete verbatim text is a famous defining cornerstone keynote. Aranya diadema, papal cross spider. Papal cross spider. The hallmark of Aranya is extreme unmatched susceptibility to dampness and water cold. The sensation of coldness running through the bone that cannot be relieved by warm blanket or external heat to the Aranya diadema. The text box, patient living or working in a damp cold basement or milk, dairy, cattle, rheumatism or skin complaint, Alkamara is indicated for complaint brought on specifically by sudden changes from hot to cold wet weather but lack the known coldness of Arania. The atom self another major hydrogenoid constitution but characterized by comparing warts in rainy weather. What it tries for to classify priority of treatment. Priority of treatment. Tries is a French word meaning to sort or choose the emergency medicine disaster management. They refer to systematic process of sorting and classifying patients based on the severity of their medical condition to determine priority of treatment and evacuation. When medical resources are limited, patients are historically color coded. Red, life threatening; yellow, serious but immediately life-threatening; green, minimal injury; black, disease or death. Diseased are injuries to severe but that survival is unlikely even with maximum care. Which of the following is used for preparation of aqueous mother solution? VA5A, VV5B.